That constant wheezing and coughing, chances are you chalk it up to a cold or allergies, but doctors find many people may be sadly mistaken. Their symptoms could actually be asthma.
I think asthma has shifted from the traditional thought of it being a disease of childhood to now increasingly being recognized in adulthood as well.
Doctors believe both genetics and environment play a role. Either way, the result is a growing number of grown-ups being diagnosed with asthma. Many times the signs were there all along.
A lot of these adults, when we actually see them and we go through a history and assessment, they meet all the symptoms and criteria that they could have been diagnosed as a child, but that criteria was not around then.
In the past 10 years, the number of adult asthmatics rose by almost 30%, the CDC found. Some are long-standing but undiagnosed cases, but many times the condition is what's called adult onset asthma, which means it's acquired over time.
Folks who have never had asthma in their childhood and they get asthma when they're older, we see quite often. Sometimes the confounding factor with that also is acid reflux disease. Sinus disease and postnasal drip deeply connected with asthma symptoms. One of the most common causes of chronic cough in an adult, turns out, is asthma.
Along with pediatric cases, adult asthma needs treatment too. Lee Memorial Health System offers a program for asthma management.
They come in once a month. They see a certified asthma educator. We do still peak flow monitoring, and it can tell them that they're starting to have problems. We still do asthma action plans.
At any age, asthma is nothing to play around with. For Lee Memorial Health System, I'm Amy Oshier.